Colleagues and friends, I'm really pleased to introduce to you a campaign which has become very, very important to me over the last month. And in order to better explain it to you, I'm very happy to have William Wines with me here from Paris, who will be connected to us. Hello, William.
Hi, Chris.
So, William, could you explain in a few words what We Care is all about and how it came into being?
Sure. So We Care's mission is to rebuild patient confidence and help all stakeholders provide effective and timely cardiac care through knowledge, education, and training. So you may wonder, how did it come about? At the onset of the COVID-19 crisis and afterwards, many authorities have postponed non-essential medical procedures until the outbreak could be better understood and contained. The We Care initiative stems from the observation by cardiologists that too many patients are still postponing appointments and declining procedures, even those suffering from life-threatening situations. So the consequences are dramatic, of course, for some patients, but even survivors, those who survive, can have a drastically reduced quality of life, and the potential burden on the healthcare system is unforeseeable. Today, still, the figures show that approximately 40% of patients continue to put off going to the doctor's office or hospital for far too long. As I mentioned, the repercussions are dramatic, both for the individuals and the healthcare systems.
Yes, and this is exactly the point why PCR and Stent Save a Life decided to join forces to launch this important initiative. We did this immediately at the end of the first wave. And over the last month, we put a lot of effort into really understand the magnitude and the dimension and the impact which this pandemic had on our patients. So we gathered a network of specialists, cardiovascular specialists, epidemiologists, and infectious disease specialists, and we grouped them into different working groups to understand factually what was the impact of the COVID-19 pandemic on our patients, on the cardiovascular health care. And we wanted to understand also the perspectives of our patients. How do they feel? What are the reasons for them not coming to the hospitals? We wanted to gather strategies and recommendations from all over the world and at the end be able to propose practical solutions. And to connect all these dots, all these specialists, the entire network have made several meetings and gatherings to exchange on how we should put this initiative together. So, William, would you be able to give us a few key messages that we found?
Sure. I think in summary, two key messages for the patients first. Patients must realize that not seeking or pursuing medical attention for cardiovascular care will almost certainly damage their hearts, while the risk of contracting COVID-19 today in a controlled healthcare environment is much, much lower. And as to public authorities, we need to make them aware that time is of the essence when it comes to heart disease. Public authorities and decision makers worldwide must remember that delaying medical attention for critical heart problems is no different from delaying cancer treatment. These are two strong messages, isn't it?
Yes, it is. These are strong messages. And in order to give you some ideas about the real magnitude and some figures, I'm very happy to welcome Darren Millot from Ireland to speak about some of the results from the working groups.
Thanks, Chris. Have the slide deck up, that would be fantastic. So my group, Chris, were charged with evaluating the magnitude of the disruption in cardiovascular care during the pandemic and indeed during the various national lockdowns. Again, if I could get the slide deck up, thank you. The group was a multinational group, as you can see. And if we move on to the next slide, you'll see really where our focus lay. We wanted to understand the impact on diagnostic procedures, elective PCI acute coronary syndromes, and indeed on transcatheter heart valve procedures. This very important piece of work from the International Atomic Energy Agency reveals the magnitude of disruption to diagnostic procedures. This survey from over 800 centers worldwide shows about a 70% reduction in echo, about a 50-60% reduction in invasive and CT coronary angiography and stress testing, and really shows how diminished our capacity was to be able to diagnose and treat our patients with a variety of cardiovascular diseases. This slide was what we were all talking about during the lockdown, that we managed to preserve our STEMI pathways, but the patients went away. We saw about a 23% reduction in the number of patients presenting with STEMI and a 40% reduction in patients presenting with non-STEMI. Now, various reasons for this were proposed. Perhaps it was that patients were staying at home and in a less stressful environment, take more exercise because of lockdown, less air pollution. Maybe there were less acute coronary syndromes happening. Very damning data from the United States, from the National Center for Health Statistics, show a huge spike in the number of patients who died from ischemic heart diseases during March and April of 2020, really showing us that these patients were not at home and well. In fact, they were dying because they were not attending for cardiovascular care. On the next slide, you're going to see the impact from the global COVID TAVI study, which has been commissioned as part of the WeCare project. And we see that in approximately 27% of centers studied, elective TAVI procedures stop, while nearly 50% significantly reduced the elective TAVI procedures. The question is there an impact from delaying these TAVI procedures? And the answer is yes. Data from a variety of sources, including Switzerland and New York, show about 10% of patients will have a cardiac event, that is, hospital admission, stroke, or death within 1 month, and over a third of patients will experience an event within 3 months of TAVI deferral. So to summarize, Chris, we know that there's been a reduction in diagnostic procedures and outpatient care, a reduction in ACS presentations, and indeed in structural heart procedures, and that this reduction has increased mortality due to ischemic and valvular heart diseases. And as such, the project is committed to providing national and local strategies to avoid cardiac care deferral during future pandemia and lockdowns. And I'm going to quote that I found illuminating, that the diagnosis and treatment of cardiovascular disease should be designated a health priority that remains intact during pandemia, as the magnitude of harm induced by its interruption really is substantial.
Yes, thank you very much, Darren. And William, maybe you can comment on these messages, because I think they are very clear and loud.
Yeah, absolutely. What can we say, Chris? These numbers are dreadful, and it shows that it is time to increase awareness and to act.
Yeah, absolutely. And I think this is the reason why we want to launch this campaign today. This campaign is now launched globally. And we really need you, our colleagues, to spread the word and to launch the message in your town, in your region, and in your country. And at the end, our patients have no better representatives than you. So we really need you to join this effort and to make a difference in the awareness and in the preparedness, and at the end, a difference in the care for our patients. William, so is this a short-term initiative, or are we going to continue in the future?
Well, I really think that the initiative is going to roll out progressively. And of course, we're in for some short-term action, but down the road, if you want to have an impact on all stakeholders, from the patient and the families all the way up to the scientific societies or international organizations, we are definitely in for a project that will last several months, if not years.
Thank you all very much. Flavio, you were able to join us finally. So I think it's very important that we still have you here, because your working group was about different issues. Your working group was about finding solutions and looking at practical solutions in daily care. So it would be great if we can go with your presentation and you can give us some insights.
Thank you, Christophe. Thank you, William and Darren. I think that we must say that in a year we really changed our life and we reorganized our health system and created efficient vaccinations. But the price we paid to cope with this emergency was very high, and it's not said that this situation will not be repeated. And so we have to prepare for this not happening again. We cannot remain passive in front of the inadequacy of the political and organizational system we have lived, because in the past year we assisted to the interruption of cardiovascular care. In a desperate attempt to cope with the COVID emergency, and the patients even stopped seeking for help. What didn't happen with other specialties, like in oncology, for example. So this underlines the ignorance of both the medical system and patients about the inherent risk of the cardiovascular disease. So very practically, as cardiologists, we have to fight to keep our COVID-free division destination. It will be difficult sometimes, but it's a must, because if the division gets infected, we stop working. We need to provide safe services for emergency treatments like primary PCI and pacemaker implantation, and to test all the patients to keep clean. And if a patient is infected, should be transferred to a dedicated area. Starting from the emergency room, dividing the emergency room for infective and non-infective patients, and then in the ward, keeping the patients separate in isolated rooms and avoiding any kind of unnecessary emergency examinations. Even an X-ray may be dangerous for the patient going to the radiology department and coming back with the infection. So the other point is also very important, to create a list of priorities. Those patients that cannot be delayed are patients admitted to the emergency room, those with symptomatic coronary artery disease at rest or minimal effort, those in waiting list for TAVI being very symptomatic, and those needing cardiac stimulation. Then we will think about other indications, but these 4 diseases cannot be denied for patients. And of course, if you don't have an option in surgery, try to shift conventional surgical indications on the endovascular options, which might be life-saving. Very important is to activate a program of remote consultations, a toll-free number, a telephone for patients seeking for help, and a Zoom link for these extra hospital colleagues that need for an advice for the patients that cannot be sent to the hospital. And last but not least, mass media is important. You as a clinician should reassure people, telling which is the state of your division. If you can serve your patients safely, and they will trust in you and they will keep on coming to your hospital. You have to appear in the mass media communication together, supported by your scientific societies, to issue general appeals and press releases.
Yeah, thank you very much, Flavio. I think this was an additional, very important piece of information. And it's in particular of importance because we have at the We Care initiative, with the help of all the colleagues, prepared a lot of material which can be useful for you. Again, we need you, our colleagues, to do the advocacy for our patients, and we need to work together. And this is why we would like to invite you to join us. And I would like to leave the final word to William Wines.
Thank you, Chris. A few words, and I would like to thank Flavio for this contribution. It really, what he has said really comes from his own practice. So it's a best practice example that all of us can implement. So the message to the physicians is very simple. We have to spread the word, but also we need to empower our colleagues locally, and make sure that the continuity of care is ensured. And basically 3 bullet points from Flavio's presentation now. Don't postpone the care of cardiac patients. Don't postpone the care of cardiac patients. Prepare your institutions, because the COVID did hit us in a state of unpreparedness. So let's prepare our institutions. And the third one is develop the use of telecare. So for the healthcare professionals at this stage, summarized, of course, much more information on the website. So I'm handing over to you, Chris.
Yeah, thank you very much. So please take a look at our website and stay tuned. There will be much more coming, but we need your help. Thank you very much.
The past year took a toll on the way I practice. Through the uncertainties and through the fear, I held up, and you did too. But the effect of the pandemic on our cardiac patients will be long-lasting. Today, fear of COVID-19 prevents about 40% of heart attack patients from seeing their doctors. Each passing day, millions of patients postpone their cardiovascular care, leading to increased heart damage, morbidity, and mortality. Because their heart condition won't wait, PCR and Stent Save a Life have joined forces to launch We Care, to restore patients' faith in pursuing timely medical treatment through a global campaign. We must all take an individual and active part in preventing procedure postponement and accelerating change in our practice. We care about hearts. We care.